This is your Houston Chiropractor Dr. Gregory Johnson, and we have Jeanette here with us this afternoon. And Jeanette was referred in here by her friend Alejandra, who's been a patient here for a long time. Jeanette was diagnosed with fibromyalgia, what did you say, 10, 12 years ago?
Yes, sir.
And you've been treated for fibromyalgia for all that time with pain pills and muscle relaxers and shots and other activities like that, physical therapy,
Yes, sir.
things like that. And has any of that really helped you?
Very little.
Just helps kind of knock the edge off the pain?
For a little bit, and then it comes back worse.
Okay. The topic of this video is going to be fibromyalgia. Is it really fibromyalgia, or is it multiple areas of biomechanical improprieties or subluxations that causing neurological interference, causing muscle spasms and trigger points and knots in the muscles? Fibromyalgia diagnosis gets thrown out there a lot because it's an easy tagline for a lot of physicians to use. That way they can prescribe you most everything and do other procedures on you because they wanted to do a nerve block on you too, right?
Mm-hmm.
But she has resisted some of those things, and she got referred in here by Alejandra, who after her first adjustment, she went skydiving, right?
Yeah, I want to do that too.
Yeah, so she wanted to do that too. So this is her first treatment. I've already done her orthopedic neurological evaluation, but we're going to go over some of the highlights. Let's have you flex your head forward and backwards. And then neutral. Okay. So I can tell she's a side sleeper just by her posture. Her head's translated over to the left and forward, but it's tilted off to the right just a little bit. And then down here in her pelvis, you got a little more room here than you do over here. Do you see that? So your pelvis has shifted right of center. And her head being so far forward, she's getting this little hump up here called Dowager's hump. And that's why she's so tight up here in her upper thoracics. That will cause muscle bundles and trigger points in the trapezius muscles, the levator scapula muscles, and the rhomboid muscles, which oftentimes that gets labeled as fibromyalgia. Fibro just means fibrous tissue, collagen fibers, which is the same thing that scar tissue is made up of, and then myalgia just means muscle pain. So fibromyalgia is kind of a scar tissue type muscle pain. That's what that means. So let's go ahead and lay on your tummy for me here first. Now again, I've already done her orthopedic neurological evaluation, but I'm going to do a couple of the highlights here. Her left leg is shorter by 1/2 inch. When I bring it up, it gets even. That tightens up in her low back and pelvis right there. And she is more sore right there on the left SI joint than she is over here on this right SI joint, right?
Mm-hmm.
And that's really tender right there too at L5. Mm-hmm. Now see, I'm feeling out in her muscles because patients that have been diagnosed with fibromyalgia most often have a muscle tension or knots in their muscles, sometimes trigger points, not always trigger points, but muscle bundles. That's real sore right there.
Yes, sir.
That's a rib out. Now these are real tight muscles. These are trigger points in your trapezius and levator scapula muscles. Her neck's out right up here on the right. See 2 and 3 on the right here as well. Yep. So I'm going to have her lock her right leg straight. Lift your right leg off the table. Okay, relax that one. Now watch the difference here. Left. See, that one doesn't go up as far. So she's got a left sacral deviation as well as a left SI joint problem. So that's where I'm going to get started adjusting her today. We're going to adjust her left SI joint first, which she gets a lot of hip pain and leg pain from this, and it's really coming out of this lumbosacral and sacroiliac region. Now I'm adjusting the left aspect of her sacrum, straight superior to inferior. These will be a little sore at first, Jeanette, just because they're out of place. Now her right SI joint. Sacrum, straight superior to inferior. Now I'm going to adjust L5, straight P to A. This will be a little sore at first. L4, L3, and then we're going to work all the way on up. L2 and L1. Keep breathing. There we go. Crack addict's going to love you. Okay. I still got one right there. You feel that one?
Oh yeah.
That last one?
Right.
Okay, your legs are exactly even now. Tell me if this feels any smoother to you than the first time I did it.
Yeah.
Yep. The nice thing about this type of treatment, chiropractic treatment, is that you can not only feel things immediately, but see them in the mirror immediately as well. So there's really no guessing about the results you get. Okay, just relax this. Good. Okay, let's turn you on your back now, please. And one of the biggest problems in America today is overprescription or overprescribing of opioids, which is things like narco, what's those other common ones called? Vicodin, yeah, Vicodin, Ortabs. Flexril's a muscle relaxer. There you go. Let's slide down this way. She's already taken all that from her medical doctor. Slide down this way. You know, most of the patients that have been labeled with these diagnoses, just put your arms straight, that's too far, huh? Go up just a little bit. Now put your arms out. Have been labeled with these diagnoses, they've already been to medical doctors and had x-rays, MRIs, physical examinations, blood work, all that stuff. Jeanette was telling me one doctor wanted to operate on her foot, but then asked the nurse what her problem was. There we go. All right, now, I want you to just relax your leg right here in my hand, huh? Okay, put your hands on your tummy. There you go. You should have felt that in your knee all the way up to your back. Did you? Can you tell? Okay, relax it. There you go. You feel that one a little more?
Yep.
Okay, let's sit you up, face this way. There you go. Okay. There we go. There we go. See, wouldn't it be nice for you if this was exactly what I think it is, which is multiple areas of biomechanical improprieties, pinching the nerves, and all that can get fixed up with chiropractic care?
Yes, sir.
Instead of being labeled with fibromyalgia and having to take those pills the rest of your life.
Yes.
And we never tell patients to quit taking their medication. They'll know that on their own, and then they can work that out with their physicians on how to get off of it. There we go. Okay, let's stand over here. I'm just going to check your posture again. Let's have you flex forward and backwards. Your head. Now that's already moving better. Yep. Better range of motion. Take a look in the mirror right now. See, that's straighter than it was the first time you came in. Alright, let's come over here. Lay on your back on this table with your pelvis right there.
Okay, that way?
Head up that way, on your back. So, you watched a couple of our YouTube videos, right?
Mm-hmm.
So, I'm getting ready to do a full spine decompression on you right now, which will take a lot of pressure and compression off your spine. Slide down a little bit where your hips right underneath that pin, a little bit more. There you go. This one's going to feel really tight over here. There we go. Just let your legs bend and relax. How tall are you when you walked in? 5'5". Okay. See, she's kicking beforehand. Make sure she's still kicking afterwards. All right, nice deep breath in through your nose. Relax it. Yes, ma'am.
Gee.
And you should have felt that all the way down.
Yes, I did.
Very good. And she's still kicking, so she's good. And I don't do that to make sure they're alive. I just do that for kicks.
Oh.
Yeah.
Yeah.
There you go. Yes, ma'am.
I tried to hold that.
Now, I'm one of the
I feel
old,
like a piece of chicken.
I'm an old-fashioned chiropractor. I move bones. The old-time chiropractors coming out of Palmer and Parker. I'll sit you up. And Life West. Face that way for me. They adjusted the entire spine and pelvis, and a lot of times did the extremities as well. Same thing that we do here. Here's one thing I'm still going to do. I should have done it when your legs were up there. I told you I was going to adjust your feet, and I still am. We're going to adjust your feet for you today too. Good. There. Okay, go ahead and lay on your back again. Scoot down this way just a little bit for me, huh? Okay, you're going to feel your legs being raised up. Now she's had pain going down both of her legs all the way into her feet, so I'm going to adjust all the way into her feet. There we go. Okay. These are the phalanges, little piggies. Okay, just relax this one. Okay, there we go. That's a girl. Okay. There we go. That a girl. Okay, good. Now we're going to come over here in front of the mirror again. We're going to check your posture out again, Jeanette. So let's go side, kind of get up sideways. Bring your legs over and push yourself up and then straight up. There you go. Okay, let's stand right here in front of the mirror again. Okay, now I want you to close your eyes again and bend your head forward and backwards for me. Remember how this feels. Back to neutral. See, she's still got a little kink going backwards, but a lot better alignment. Take a look.
Yeah.
Pull these shoulders up and back. This is your homework right here. Flare these hands way back here like this. Now see, her head's forward to the right, so we're going to come straight back. We're going to translate left, and then I want her to look at the ceiling behind her, the wall behind her actually. Right there. Good. Okay, now relax. And let's try that very same thing again and tell me if this feels any different to you and how.
Yeah.
That feels smoother?
Just a little bit, but I still got.
Still a little kink right there? Here.
Goes all the way down here.
Yeah. I'm going to bounce your muscle spindles right here. This just changes the Golgi tendon apparatus and the muscle spindles and helps lengthen the muscle fibers so that when they move, they can move a little smoother through a range of motion. Okay, try that again.
Yeah.
That should feel a little easier.
Yeah.
Okay, good. Well, Jeanette, would you mind sharing with our YouTube audience this, your very first chiropractic adjustment here at Advanced Chiropractic Relief? How did it feel to you?
Oh, awesome. I already feel the difference. I already feel that my body's more relaxed. I don't feel the tension in it anymore. The neck is better.
Feel like you got better circulation?
Yeah.
Yep, good.
Yep.
All right, well, thank you for sharing your story with us. If you've been diagnosed with fibromyalgia, you may just have multiple areas of biomechanical improprieties in your spine, your pelvis, and your neck and shoulders. So consider getting chiropractic checked out and see if you're a chiropractic patient or not. This is your Houston Chiropractor Dr. Gregory Johnson coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see y'all soon.